Miscarriage is common, but that doesn't mean it doesn't matter. It's time to normalise the topic of miscarriage so the conversation is just as common.
I wanted to make this film because I am currently going through my second miscarriage. You know, you think, God, why again? What's wrong with me?
It was nice to find Virtus Health wanted to know more about what I learnt on my journey.
It's made me think very differently about how we should support our patients who go through that and their families. Every embryo that's transferred, if it doesn't result in a pregnancy, it's a pregnancy loss. It's not a, failed IVF cycle, it's a pregnancy loss.
If you've ever received bad news in a doctor's office, I don't need to explain those feelings. It's overwhelming and heartbreaking. And how your doctor delivers that news can shape how you process everything that follows.
We will, as professionals, see this every single week.
Of course. And it is statistics and cells, and it's very,
Nobody likes to talk about bad news, particularly in our profession where we talk about a lot of very happy things.
I feel that's where Virtus Health are really starting to make progressive change.
We have been pulling back on starting people straight after a negative cycle and bringing them in.
We've become much more flexible with this, not asking people immediately what they want to do, but perhaps giving them some time, because if you make that decision 2 days later or 3 days later or a week later, it doesn't make any difference, okay? It's not going to alter their outcome. We need to go with whatever the woman's desires are, her expectations, her environment, her support.
And knowing that not only do they need support at the time of the diagnosis, but potentially for future pregnancies, because it brings up those emotions and those memories and those experiences again.
What are some of the new testing, and what does that look like?
We used to say that if somebody has a pregnancy loss, you don't need to do anything at all, okay? And you only start investigating after they've had 3 losses. And I think this has now been the big shift. What now happens is that if somebody has a pregnancy loss for the very first time, we would do genetics and we would do an assessment, because it's now much more accessible than it used to be. If it shows that the pregnancy loss was due to a genetic abnormality, then I know the chance of this woman having another pregnancy loss is in fact very, very small, and we can reassure them about the outcome.
Yeah, and I guess that gives you guys answers, it gives the couples answers. And
correct, exactly right.
The chromosomes are particularly important, that's number one. The next thing is a structural abnormality of the uterus. And then there's other things like endocrine problems, so thyroid function, looking for things like diabetes, they're particularly important as well. And very rarely there's also autoimmune conditions.
And not forgetting the partner sperm. We do further analysis on the sperm to look at the DNA quality. So they are all the different tests that we can do to try and answer why. Often I tell patients there are many ways to achieve your dream. And if some people feel taking that extra step is not for them, that's okay. Then we look at points of closure. How do we come to the decision that the dream that they perceived may now be different? One way or another, we should be able to come full circle and actually help them to an outcome.
I think the advice I would give is to make sure that they have a doctor that they have a good connection with, that they feel that they can ask as many questions as they need to. I think it's really important for them to know that the door's always open.
Healthcare, the more personalised it can be, the more effective I think it is.
What do you hope, or what would you like to see more of?
I'd like to be able to reduce the risk of miscarriage related to modifiable risk factors. Medically, I can adjust some things, but I think that if I can emotionally support a couple to get to that point so that they're both physically and emotionally well, then I can take a big breath and say, okay, my job for now is done.
Really what drives me, and I think most of the people who work in healthcare, is making a difference to someone else.
It's time now to talk, to get the conversation growing. This starts with all of us. This can start with you.
I really hope that as medical professionals, we can handle the situation with more empathy. And remember, as a good doctor, it's not just about the science. There is a bit of art and there's a bit of soul.